Good afternoon, ladies and gentlemen. It is indeed another day, a new day, a bright Sunday, a day that the Lord has made that we should all be glad and rejoice in it. You don't like this day, which other day would you prefer? Today is yet another episode of health issues. Sorry, my background is not showing health issues, but it is health issues. This afternoon, uh, the topic for the afternoon is preventive measures of cataracts. Often, we have so many problems with our eyes without knowing the exact problem that we are suffering from. People tend to give names or go to the pharmacy just to get any medication because they think, oh, someone had eye drops, which worked for the person when the person was complaining of uh, his eyes or her eyes. But it worked for that person, so why don't I try? Then they get whatever they think they can lay their hands on it. Today, bringing to you from Richmond Media at your doorsteps. My guest for today is no other person than my own brother, Mr. Addai. Mr. Addai, you're welcome to Richmond Media.
Thank you.
Mr. Addai
Thank
is a
you.
nurse specialist in ophthalmology. So today we are blessed to have him here. Mr. Addai, the floor is yours. How are you today?
Thank you.
To our listeners and viewers this afternoon, we encourage you to send a message. Even if you say hi, we'll be able to recognize or acknowledge you this afternoon. So continue to stay tuned as we start the journey together until the end of the program. I'm very sure that you'll be blessed. Even if not you suffering from cataracts, your family member, your friend, or it could be even your patient that you yourself you have no knowledge about eyes or ophthalmic, you have no ophthalmic background. But this afternoon, if you continue to stay with us, you will get information. Your knowledge will increase so that you can cascade it to other people who have concerns with their eyes. Mr. Suru, often we have so many problems, especially back in Ghana. So many
Yeah.
people are suffering from cataracts, which they have not been able to identify because they don't like to visit the hospital. They don't like to see the doctor, but they want their eye problems to be solved. This afternoon, what have you got for our viewers and listeners? What is the overview of cataract, please?
Okay, thank you very much. And I thank my listeners who are listening from Ghana and UK and other countries. This afternoon, I want us to take this privilege to learn something about cataract and how we are going to prevent it and manage it well. Statistics have shown that a lot of people are suffering from cataract due to maybe financial issue that the person is not able to afford the medical bill, or due to maybe the person doesn't have any knowledge why or the reason or the essence for going to hospital for treatment. This afternoon, I want us to go through the eye. And before we start, I would like to give some little background about anatomy of the eye so that my listener will be able to understand what I'm talking about. When you look at the eye, I will prefer to use mine as an example. When you look at the eye, the way God created human being made the eye in such a way that it has its own way of protecting from external trauma, external invaders, or external thing that may tamper or that may try to come onto the eye. So when you look at the eyeball, you have bones that is being surrounded around the eyeball. So looking at the temporal place where my hand is, to the medial, the superior, and the inferior, it all has bones that surround it. And what happens, these bones hold the eye in place to prevent any trauma that may hit on the eyeball. So what happens is, if these bones are being broken down, then the eyeball will be exposure to any kind of trauma that may come along and which may cause damage to the eyeball. So God created these bones to serve as a protection. Again, when you look at the eye, it also has some nerves that hold and muscles that hold the eyeball in place. It just looks something like an egg, and with something like a wings that hold it from left and right. So this ligament that hold the eye in place will help the eye to be stable so that you'll be able to focus on an object. When you look through somebody's eye, you will see some whitish part and you see some part which is gray or black. All these structures are part of the eyeball, and the main function is it helps to sustain trauma and also prevent infections. I quite remember 3 months back, there was this hemorrhagic conjunctivitis, popularly known as the Apollo, which started spreading around my area, I mean Ghana. A lot of people were being affected by this infection. So this what happens. It's a viral infection. So the eyeball will produce some kind of chemicals, some substances, which will help to lubricate the eye. And the functions of some of these chemicals will help to reduce the amount of the severity of this infection or this virus that will come onto the eye, which might cause the eye to maybe go blind or maybe be affected with any kind of infections, and which may later on lead to severity, which cannot be prevented. So these structures, like the conjunctiva, the cornea.
Ladies and gentlemen, Mr. Addai is being
Structures. So when these structures hold the eye in place, it helps the eye to be stable. Now, when you look at the eyeball, it's by convex a transparent structure, which is situated posterior to the iris and anterior to the vitreous. And this because of the structure of its structure nature, it has a highest protein level, and this protein level is contained in this eyeball. So when you look at it, it's a transparent. So substance can pass through it, light can pass through it. So light passes through the cornea onto the lens, and the lens also allow light to pass through it onto the back or onto where we have the retina and you have the macula and stuff. So the light passes through the black thing or the gray thing that we will see, and it moves through that black or the gray thing onto the lens, and then it passes through the lens onto the retina, and the retina also converts this light into a neuron, which will be transported to the brain to interpret what you are seeing as an image, whether it's an animal, a human being, or an object. So it interprets it for you to see it well. So what happens is, because of its transparent nature, it has no blood vessels on it. It has no nerve supply on it, because we want objects to pass through these substances to the back. So if it is not transparent, object cannot pass through it. So the normal lens is a transparent substance, and the function is it does or it allows light to pass through for visible vision for you to see an object at a distance. So now this is what happens. People with cataract, because of the lens nature or the way it has been affected, images are not being able to pass through it. How does the lens being affected? The lens, as you grow or as you are growing, the lens produces this protein as I made mention earlier. So this protein is being produced continuously. So the old ones are being shed at the lateral part. So as the lens keep on growing and the protein keep on producing, the old ones are being shed. So it will either move to the peripheries around the lens, or it will move to the center of the lens. And this is where cataract comes in. So when you say cataract, in simple terms, I would say it is an opacity or clouding of the crystalline lens.
Thank you so much, brother. Ladies and gentlemen, as you keep watching and listening to us, please don't forget to subscribe and share to your friends and family so that everyone can come on board together. We can have or we can discuss this topic together. Cataract is very important, affecting so many people. among us. So it is therefore very important for all of us to come on board. Whilst we're waiting for our brother, Mr. Suru, to join us, the network from Ghana is not, sometimes it's not stable. So please bear with us as we continue to, the program. Whilst we are waiting for him, I think there are some comments that I would like us to share. Brother Akon Joy says, good afternoon, watching you live from Ghana in the Volta region. Good afternoon, brother. Thank you so much for your time and everything with us all the time. Awua Hene says, good afternoon. I'm watching you live from Ghana, Holy Family Hospital, Techiman. Thank you so much, Awua Hene. A champion, no. We thank you for joining us this afternoon. Mr. Akon George said, Mr. Suru watching you live. And Sister Ivona Samoa says, watching you from Ghana, Takradi. Good afternoon. Thank you, sister, for supporting your sister. Mr. Suru, please, the floor is yours. Thank you so much.
So in simple terms, I just wanted to say that cataract is the opacity or clouding of the crystalline lens, which impede or which reduce the vision or ability for you to see at a distance. Thank you.
Thank you so much for the overview of cataract, which will make our listeners and viewers understand the topic that we are talking about. So, how can cataract? Okay, please.
So, as I said earlier, when you look at the lens, it is a transparent substance which contain a lot of protein in it. So this protein, as you are growing or as you are aging in life, then the protein will be producing, and the old ones will be shed or will move from the center, that is the nucleus, onto the peripheries of the lens. It doesn't move away from the lens, but it stays in the lens. So as you are growing, new ones are being produced, and then the old ones move for the new one to have its space. So as you are growing, it will come to a time, these old ones that has moved onto the cortex of the lens or the peripheries of the lens will start impeding vision because it becomes so much there, so it becomes packed, and then it starts to block the transparency of the lens onto the retina. And if the lens becomes opaque, it means there's no substance or any light cannot pass through it. And if light cannot pass through it, what happens is you wouldn't be able to see anything at a distance. So the old ones will keep on shedding off, and then it will cover up some space, either the whole lens or some part of the lens, and that will impede or reduce vision. So in the overview, that is how cataract occurs on the eyeball.
Thank you for giving us this information. If that is the case, now that we know how cataracts occur, what are the possibilities or the causes of cataracts, if one may ask?
Okay, before I move on to the causes, let me just chip in this small thing. When you look at cataract, you have classification of cataract. We have some people, or depending, World Health Organization has so many ways of classifying cataract. Some classify according to the onset. Some also classify according to morphological, and some also classify it according to the maturity or the etiological. So when you look at the onset or classification based on the onset or the age of the onset, it could be congenital. So congenital means that the person acquired it from uterus, from her mom, before she was being delivered. Some too, immediately the child was being born, then the cataract will develop. That is the infantile. And some also start from juvenile, that is around 2 to 18 years. And some also presenile, around 19 to 59, thereabout. And aged, that is around 60 and above. So all these stages that I'm talking about can bring about cataract. Some also can also say that the cataract is at the nucleus, as I said earlier, because old protein are being produced, new one are being produced. The old one is being pushed away. So some remain in the nucleus, which means the center of the lens. So it impedes vision. So the patient will tell you that I can see when I raise my eyes up, but when I look straight, I cannot see. So this is one of the symptoms that they normally complain. Some can also be at the cortex, at the around the eyeball. So it means that person can see straight, but when you look the peripheries, the person cannot see. And some too can also be at the polar cataract, and some too can be subcapsular. All these things are type of cataract that can occur on the eyeball. Now, let's look the classification or the etiological causes due to time. When you look at the etiological factors, we have the metabolic. It could be of diabetes or diabetes mellitus. People who have diabetes are at high risk of also developing cataract. Some too can be from galactosemia. As a result of galactosemia, they can also get cataract. Some too can be as a result of hypoglycemia. So all these things are part of metabolic ways that can cause cataract. And then you also have toxic like gold or steroid. Steroid is some of the medication that people abuse it. So abuse of this medication can also lead to cataract. And some too can be as a result of trauma. When somebody gets trauma on the eye, it could be of blunt trauma, maybe a blow on the eye. It could be of penetrating trauma or penetrating object. It could be maybe a pen, a pencil, maybe a stick or something sharp that can penetrate onto the eyeball. Some too can be from electric shock. Some too can be from radiation and then chemical burns. All these things are ways by which the trauma or cataract can occur on the eye as a result of trauma. 3 days ago, I was called in the evening to come and see a young boy who was playing with his brother at home. And then the brother used a pen. It wasn't intention, but he used the pen just to stab on the right eye. So in such cases, if the child is not lucky, it may develop or cataract may occur. So in this case, it's a trauma that has occurred or that has made the cataract to occur on the eye. So these are some of the ways that which somebody can get cataract on the eye.
Thank you so much, brother, for what you have given us so far. It tells us that indeed you know what you're talking about. Now that we know the causes, the possibilities that cataract can occur to us, what or who is at risk of getting cataract? I know you have mentioned some of the age concerning the causes, age groups, but you have maybe additional, or if you want to elaborate on those ones, we will be happy about that. Thank you.
Thank you. At first, that was way back 50, 30 to 50 years back. It was old people that usually get cataract. The reason is as they are aging, the old ones are left on the lens. So as they are aging and they get to their old age, then because of the piling up of more old protein on the eye, then the vision starts decreasing. So the person needs to undergo cataract surgery to remove it. But I don't know whether it's the environment or the climatic changes that has now extended down onto young ones, because now teenagers, 10 years, 12 years, 15, 18, they also get cataract. So now the onset is from birth to maybe 6 or to until you die. That is when now it has now fallen to everybody is at risk of getting cataract. So now you need to do something to prevent the occurrence. If not, you are likely to get the cataract no matter the age range of late.
Thank you so much. What are some warnings or signs that cataract brings along?
Okay, the most common one is blurred vision. So the patient or the person will complain that I cannot see far. If I raise my head, I cannot see objects at far. Some too may tell you that I see rainbow colors anytime I raise my head or anytime I look forward. I see something like a rainbow colors. These are clinical symptoms that the patient may complain. So it is a gradual and a progressive vision loss. So it doesn't start all of a sudden. It's a gradual because the protein will be piling up gradual. So gradually, the vision will be decreasing. And then another one too is refractive changes. So the person may get myopia. So the person may complain that I cannot see object near, unless the object goes far before I can see. So the person has become myopic. So in that case, the moment you do refraction, when you say refraction, the moment you try lenses to see if the person can get spectacles to use, then the person will tell, now I can see well. I can see very well at a distance. So it's also one of the clinical symptoms that also make you to know that the person is getting it. Some also come with drizzling. So it's also one of the clinical symptoms. Some also comes with multiple images or ghosting. So you see multiple images. It is also one of the clinical symptoms. And something may tell that I see halos of light around light. So anytime I look forward, I see something like dark spot in my vision. It's also one of the symptoms. And the last one is leukocuria. Some people will be complaining that I see some whitish thing on my eye. That is the common one that our grandmom, our mom, and then our medical doctors who are at home used to see. He will tell you that I can see some whitish thing on your eye. So that is the leukocuria. But that one is easily visible for you to see that the person has cataract. So these are some of the symptoms that the person may show for you to know that it's getting cataract.
Thank you so much, Mr. Suro, for how far you have taken us through this topic, preventative measures of cataract. So, if you have cataracts or any member of your friends and family is suffering from cataracts, this is the opportunity for you to listen or call the person to join us, or you can send a link to the person to join us as we all discuss this topic together. If you have any question or any suggestion, any contribution, don't forget to pop it at the comment section, please. Thank you so much, Mr. Suro, for this explanation. So we know now that we know who is at risk, we will be looking forward if we have the symptoms that our brother has mentioned, any of them comes along, then we will be able to even pre-diagnose ourselves. But we're not saying you should go and get medication for yourself because you are not a medical professional. But however, that will prompt you to go and see the right people at the hospital or at the clinic or your GP, wherever you are. So now, what are the various diagnostic investigations of cataract, please?
Okay. When you look at the diagnostic investigations for cataract, one, we can talk about history taking. When you talk about the history taking, the person or the patient or the client will come to you. He will complain to you that maybe I cannot see at a distance. When I look at a distance, I see some halos of light around my vision. I see something like rainbow colors in my vision. So these are the complaints the patient will ask or will come and tell you. Then you ask some direct questions because you want to be sure. Have you gotten any of these symptoms on your other eye before? Are you using spectacles? Have you done any surgery on your eye before? Is there any member of your family having glaucoma? The reason why I'm saying glaucoma is one of the conditions that cause reduced vision. So people will come and complain that I cannot see far. But meanwhile, it is not cataract. It could be of glaucoma. So in that case, you can't say that you are going to do cataract surgery for the patient. Some two may come with two, cataract and the same time glaucoma. So in that case, you need to do, you educate the patient on it. I had a client that was last week. He came to see me, and then upon my assessment, I got to know that he's already a known glaucoma patient who has defaulted and is not taking her drugs for some time now. But at the same time, he's also having cataract. So I did my assessment on both the cataract and then the glaucoma, and I got to realize that if we do the surgery for my patient, the vision will still not be restored up to how he wanted the vision to be. Why? Because the glaucoma has damaged the eye, and then the damage that he has done cannot be corrected. So I told the patient that if you still want to do the cataract surgery, you do it for you, so that you do it as a cosmetic surgery, but your vision will not be restored. So you need to do in-depth investigations, and secondly, you do physical examination. Physical examination, you assess the eye. You check. We have something that we call pupil reflex. You check to see if the pupil is able to react. You check to see the size of the pupil. and the cornea. You check to see the movement of the eyeball. You check to see if the patient is able to read the chart. When you go to the eye clinic, we have some charts that you need to read. So you check to see if the patient was able to read from the chart. All these things helps you to do your physical examination so that you'll be able to know the diagnosis that you can give. And then you can also do some investigations like you check for the IOP, that is intraocular pressure, the pressure of the eye. The pressure of the eye will make you know that this patient is not a glaucoma patient, or this patient is not suffering from any macular changes or macular diseases which will impede or reduce vision. So you check if it's within the normal, which is around 10 to 21. If the patients fall within the normal, then you know that that one is out. You can also do biometry to check the cornea and then the stuff. You can also do ultrasound. Ultrasound is also done to check to see if there's no deviation. You can also do refraction. Refraction will help you to know that is it as a result of glaucoma, cataract, which is causing the vision to reduce, or the patient is a refractive error, is having refractive error. When I say refractive error, the patient needs space to see. Is it because of that the patient is complaining? So you have to differentiate between cataract and refractive error. If not, you intend to do surgery for the patient. Meanwhile, the patient doesn't need surgery. And at times too, we also check the full blood count of the patient and then the fasting blood sugar of the patient. All these things are being done. And even sometimes we even do cycling for the patient. We do all this investigation because we want to know the status of the patient. Because if the patient sugar level is very high, we can't do the surgery. If the patient blood pressure, the BP, is also very high, we still can't do the surgery. So we need to do all these investigations to see that the patient is a candidate for the surgery before you can move on, or we can move on to diagnose the patient either for medication or for other things that we want to do for the patient.
Thank you so much, brother Addai. Okay, then. Now that we know the diagnostic investigations of cataracts, what are the preventive measures of cataracts?
Thank you. So now there's no medical treatment for cataract, but we have preventive measures. One is if the cataract is not mature, we don't do surgeries. But if the cataract is mature, it's a surgical procedure. You need to take off the cataract. So there's no specific medical treatment that a patient comes, complain on, you do examination, investigations, and you find out the patient is having cataract. So you give medication to the patient, they go and take the medication, it will go. No, there's no medication that we use in treatment of cataract. But what you can do is you can just go on to do surgery to correct this error. So this is what happens. If the patient comes and then do assessment and then you see that the cataract, the stage at the level at which the cataract has gotten to, it's not big, then you educate the patient to do refraction, or you try to give the patient spectacle to correct this error. So the spectacle will correct this error for some time. But if the cataract matured or get to a mature stage, then you have to do surgery. So medically, there's no specific treatment, but surgically, there is a treatment for cataract.
Thank you so much, brother, for such an in-depth explanation of cataracts. We have some questions here that I would like to
Okay.
read it to our attention. Oh, it's just Bridget Buama entry says, watching live from Ghana, Ifijasi. Thank you so much, sister, for your time and everything. Comfort Edu says, watching you live from Ghana, Kumasi. This is highly educative. God bless you all. Thank you, sister, for spending your time with us this afternoon. Awuahini says, Samba Habi. Oh, that is Mrs. Okay.
Yeah.
Awuahini. Champoma. Awuahini. Then I just say, me to me for a champoma. Aye.
Yeah.
That's it. When your time, if anyone has a question, contribution, you can just bring it along so that we share with our friends and family. If you are listening to us this afternoon and you're sending money to Ghana or Nigeria, I recommend only one company to you, and that is OAPay. OAPay, as soon as you send the money through, whoever is receiving will just get it straight away. Don't hesitate to use OAPay. I have tried it, and I can testify that the exchange rate is very good. There is no hidden charges. As soon as you send it, is it for school fees? Is it for hospital bills? Is it for feeding? What else? Are you embarking on any projects that you are struggling to send money to Ghana or Nigeria? Or is it because other companies have failed you? Or OAPay is ready to help you, it's ready to work with you, it's ready to send your money to wherever you want to send it to without any problems, without any hidden charges. Why don't you download the app from App Store or Google Play, and you'll be able to use it straight away? As soon as you send the money on your first transaction, you get £10, €10, $10 on it, depending on wherever you are. So I recommend it to you this afternoon that try today, and you will see the benefit of using OAPay. As soon as you send it, we take it. Why don't you try us this afternoon? Mr. Sro, now that we are almost getting to the end of our program, what is the WHO recommendations on cataract, please?
Okay. So, who, in short, recommendation for cataract is when you assess the patient and then you see that the cataract is matured or is grown or is big, then you need to recommend surgery for the patient. But when you assess it and you see that it's not big, it's small, it just started, then you can do refraction for the patient, and then you start or you encourage the patient to use spectacle so that it can improve the vision. But it also says that depending on the type of work your client does, if your client is a pilot and then he comes with just a small cataract, you need to do surgery for the patient. If your client is just somebody an old age who is not in active work, then you have to wait for it to grow a little bit bigger before you do surgery to correct this error for the patient.
Thank you so much, Mr. Suro, for how far you have taken us. We cannot stop thanking you, because without you, this program wouldn't have come on. Therefore, Richmond Media says, may God richly bless you for your time and your support and the knowledge that you have bring on board to this platform, which everyone, including myself, will be able to benefit from it. As we come to the end of the program, do you have any additional suggestion that maybe you couldn't make it, or if you want to bless our listeners and if you want to bless our listeners and viewers at this moment? Thank you.
Thank you. I just want to take just 2 or 3 minutes to talk about the surgery part. So this what happens. If the patient is being recommended for surgery, then you need to encourage the patient, and then you need to educate the patient the need for the surgery. I had a client that was last week, and he has done one eye. That is, I can't remember whether the left or right. He has done one eye surgery. And then I recommended to her to do the second one. But the client told me he has to go home and come. So I have to sit the client down and talk to her, and then psychologically psych her so that he do the surgery. But upon all that, the patient didn't want to do the surgery. He has no reason. The one that they did, the vision is very good. The patient can see very well at a distance. The patient is comfortable. There's no pain, redness, tearing. There's nothing like complaints on the eye. But still, he didn't want to do the surgery. I thought it was money issues. But meanwhile, the patient is not willing to do the surgery. So in this case, you can see that such a patient, if you leave the patient to go, upon not doing the surgery for some time, the vision will go down. And then the patient will now complain that he can't see anymore. And what happens is when this thing continues for some time, you can get cataract-induced glaucoma. Cataract-induced glaucoma. Cataract, which is as a result of cataract, the patient is getting glaucoma and reducing vision. So these are some of the things that the patient or the client is likely to get as a result of that. So you have to encourage the patient and advise her to do the surgery. The surgery doesn't take long, about 10 to 15 minutes. Then the patient or the surgery is done, and the patient will be okay, and then he will leave the area. But if the patient still keep insisting that he doesn't want to do the surgery, you need to leave the patient. So I encourage that if you know any relative who is at home, who is complaining of maybe blurred vision, who has problem in vision, you need to encourage the patient to go and do surgery so that it will correct the vision before it will get to the complication. And when you get to the complication, you cannot correct it. Some too get amblyopia. When I say amblyopia, lazy eye, it means that because the cataract has been there for some time, the eye has become lazy. So the eye is not able to focus again. And there's nothing that can be done to correct it. So we need to educate people that cataract surgery needs to be done when it's being recommended by your surgeon or your ophthalmic nurse who has recommended it to you. Thank you.
Thank you so much, Mr. Suro. We thank you for everything. We can't stop thanking you because you have given us, it looks like it's a bread of life because your eye is life. The reason why I'm saying your eye is life is when you lose your sight, then you know the benefit of your eye because you cannot do anything as you were doing it previously. When you lose your eyesight, even the way you eat changes because you have to search for the food. It is really, really, really sad. But when you have it, definitely there are ways to go around it. But if you haven't gotten yourself into that situation yet, or life hasn't taken you to that situation, I recommend you that you listen to this program very, very, very careful. And the points that we are giving out, if you take it as part of your daily life and you practice it will help you to keep your eyesight as long as you live. If you lose your eyesight, the way you even chew your food, it changes. The way you walk, everything, your whole life changes. So please let your sight be very, very important to you. It is the only part of the brain that you can see outside. It is very small, but we don't know how important this tiny bit shape is. It goes through to the back of your head. It is part of your brain. So look after yourself. Those people, when you are angry with your partners and then you go pat their face, be careful because their sight matters a lot. Let your sight be very important to you, and your life will be appreciated by yourself and everyone within your community. Today, it has been a very great afternoon having our brother, Mr. Addai Suru, with us this afternoon. Mr. Addai, do you have anyone that you want to wish, or you have any wishes, or you want to greet before we finish?
Okay, before I greet, I want to add my last word to it. I forgot one thing. I just remember it. What I've seen it when you come here in Ghana, there's a lot of people who will prefer to go to a traditional herbal medicine for medication to treat cataract. Please, let's be very cautious about that. There's no way that the traditionalist can give you medication to cure cataract. There are so many adverts on TV that people say that I'll give you medication and your cataract will go. Please, there's no proving evidence on that. So let's be cautious about this medication. Some of this medication can even predispose you to get glaucoma. So let's be cautious about these things and always seek medical treatment from our hospitals. when we encounter this kind of challenges. This afternoon I want to send my sincere thanks to my wife, that is Jennifer Champoma. She has been a wonderful woman behind me. Always she's behind me. I thank her very much. And my last thank go to my elder sister, Beta Boatin, which is in US, a Champon, which is in UK, and then my elder sister, Sister Addai, which is also in UK. They are all watching me live this afternoon. I thank them so much, and they are always behind me. Thank my regard to them all.
Thank you so much. We will call it a day. A very good afternoon to everyone who made it possible to watch us this afternoon, right from Richmond Media to your doorsteps. It has been a great time. The same time again at 3 o'clock UK time. From next week, a week today, I think both UK and Ghana will have the same time. But if you are watching us apart from these two countries, then you can convert the time to your own local time zone. The same time, UK Ghana time, 3 o'clock from next week. We shall meet you again with health issues. Before we go, we have another program that is coming to your doorsteps as well, right after this program called From the Beginning. Why don't you turn yourself around? Just have a cup of coffee or tea or water, and then join us again as we discuss a life journey of one of our professionals. Have a very good afternoon, Mr. Suru, and everyone who made it possible to this afternoon program. Until the same time again, my name is Hanna Bimah. May the good Lord continue to bless us as we enter a new week with blessings from Him from above. In Jesus' name. Amen.
Amen.